We live in an era of unprecedented advancements in medicine and technology. From robotic surgeries to personalized medicine, the innovations in healthcare are nothing short of miraculous. Our hospitals are equipped with state-of-the-art machinery, and our doctors have access to a wealth of knowledge and tools that previous generations could only dream of. Yet despite these incredible advancements, we are facing a health crisis of epic proportions. Emergency rooms are overflowing, hospital waiting rooms are packed, and news headlines are dominated by stories of health emergencies. Chronic diseases like heart disease, diabetes, and cancer are on the rise, affecting millions worldwide. These conditions are not just statistics, they represent real people, real families, and real suffering. The numbers are staggering, and the trend is alarming. This begs the question, why are we getting sicker when we know more than ever about staying healthy? Why, with all our knowledge and technology, are we unable to curb the rise of these debilitating diseases? Doctors are puzzled, families are worried, and the general public is left in a state of confusion. The answer, my friends, is not a simple one. It's a complex interplay of various factors, each contributing to the overall picture of our declining health. It's like trying to untangle a web of wires, each one representing a different aspect of the problem. It's a tangled web of corporate greed, regulatory loopholes, and a healthy dose of good old-fashioned misinformation. Pharmaceutical companies prioritize profits over patients, exploiting regulatory gaps to push their products. Corporate scandals reveal the extent to which these entities will go to protect their bottom line. We've been led to believe that these health problems are inevitable, a natural consequence of aging or genetics. The narrative is that as we grow older, our bodies are destined to break down, and there's little we can do about it. But is that really the case? But what if I told you that's not the whole story? What if there are hidden truths that have been kept from us, truths that could change the way we view our health and our future? Imagine uncovering a document that reveals shocking information that could potentially save lives. What if the very food we consume and the medications we rely on are part of a system designed to keep us hooked? Fast food, laden with unhealthy ingredients, is marketed as convenient and delicious. Pharmaceutical ads promise quick fixes for our ailments, but at what cost? Grocery store aisles are filled with products that are more harmful than beneficial. A system where profits are prioritized over people, and our health is quite literally served up on a silver platter of convenience and deceit. Corporate executives discuss profits while the public consumes unhealthy food, unaware of the long-term consequences. News clips reveal the staggering profits these companies make, all at the expense of our well-being. Buckle up, folks, because tonight, we're diving deep into the belly of the beast, exploring the hidden truth behind our modern health crisis. We'll uncover the layers of deception, investigate the root causes, and reveal the steps we can take to reclaim our health. This journey won't be easy, but it's a necessary one if we are to understand and combat the modern plague that threatens us all. Let's talk about the food industry, those charming folks who stock our supermarket shelves with an endless array of colorful, convenient, and oh-so-tempting treats. They're masters of engineering products designed to be irresistible, exploiting our biological cravings for sugar, salt, and fat. These highly processed foods, stripped of their nutritional value and pumped full of additives, are not really food. They're cleverly disguised concoctions engineered to keep us coming back for more, much like a certain addictive white powder. But we'll get to that later, and it's working. We're consuming these frankenfoods at alarming rates, feeding our bodies a steady diet of empty calories and harmful chemicals. The result? A population struggling with obesity, diabetes, heart disease, and a whole host of other chronic illnesses. Now let's talk about the connection between these processed food nightmares and chronic diseases. It's not just about the lack of nutrients, it's about the presence of harmful substances. We're talking about things like artificial sweeteners, which trick our bodies into craving more sugar, leading to metabolic mayhem. Then there are trans fats, which sound like something out of a sci-fi horror movie and frankly are just as terrifying for our arteries. These substances, combined with excessive sugar and salt, create a perfect storm within our bodies. They trigger inflammation, disrupt hormones, and wreak havoc on our gut health, the very foundation of our immune system. The result? We become ticking time bombs, primed for chronic diseases that slowly erode our health and well-being. But where do the pharmaceutical companies fit into all of this? It's a question that often goes unasked, but the answer is crucial to understanding the bigger picture. These companies are not just passive players in the healthcare system. They are active participants with a vested interest in maintaining the status quo. Well, they're the helpful folks waiting in the wings, ready to treat the very diseases that the food industry has helped create. It's a well-oiled machine where one industry's output becomes another's input. The food industry produces unhealthy products that contribute to chronic illnesses, and the pharmaceutical industry steps in to offer solutions, often in the form of lifelong medication. It's a cynical, symbiotic relationship, a bit like that bird that picks parasites off a hippopotamus. Except in this scenario, the hippopotamus is us, and the bird is charging us exorbitant prices for its services. Think about it. The pharmaceutical companies are not just picking off parasites, they're ensuring that the parasites keep coming back, so they can continue to profit. Except in this scenario, the hippopotamus is us, and the bird is charging us exorbitant prices for its services. Think about it. We're not just paying for the medication, we're paying for a system that keeps us dependent on these medications. The cost of healthcare is skyrocketing, and families are feeling the pinch. Medical bills are a leading cause of bankruptcy, and the stress of managing these costs takes a toll on our mental health as well. We're bombarded with advertising for medications to lower cholesterol, and it's not just on TV. It's in magazines, online, and even in our doctor's offices. These ads are designed to make us believe that we need these medications to live a healthy life, but they rarely mention the lifestyle changes that could make a significant difference, regulate blood sugar, and manage the symptoms of chronic illnesses. The focus is always on managing symptoms, not on curing the disease. This approach ensures a steady stream of customers for the pharmaceutical companies, but it doesn't do much to improve our overall health. We're treating the symptoms, but ignoring the root cause. These medications are often essential for managing these conditions, and for many people, they are a lifeline. But we have to ask ourselves, why are so many people in need of these medications in the first place? The answer often lies in our diet and lifestyle choices, which are heavily influenced by the food industry. But they rarely address the root cause, our diet. The food industry spends billions on marketing unhealthy foods, and we, the consumers, are bombarded with messages encouraging us to eat more, drink more, and indulge more. It's a cycle that's hard to break, but it's one that we must address if we want to improve our health. The pharmaceutical industry thrives on a sick population, and the food industry is their unwitting, or perhaps not so unwitting, accomplice. Together, they create a perfect storm of poor health and high medical costs. The executives in their boardrooms are well aware of this dynamic, and they are more than happy to keep it going as long as the profits keep rolling in. And the food industry is their unwitting, or perhaps not so unwitting, accomplice. The processed food production lines keep churning out products that are high in sugar, fat, and salt, and we keep buying them. It's a vicious cycle that benefits the industries involved, but leaves us, the consumers, worse off. It's a vicious cycle of profit-driven misery, and we, the consumers, are caught in the crossfire. But it doesn't have to be this way. We have the power to make different choices, to demand better options, and to hold these industries accountable. It's time to break the cycle and take control of our health. And we, the consumers, are caught in the crossfire. But awareness is the first step towards change. By understanding the profit motives driving these industries, we can start to make more informed choices. We can prioritize whole, unprocessed foods, advocate for better food policies, and support healthcare practices that focus on prevention rather than just treatment. The power to change the system lies in our hands. This cycle, my friends, is further perpetuated by the immense power and influence of Big Ag and Big Food. These behemoth corporations control every step of the food chain, from the seeds we plant to the food on our plates. They lobby for policies that favor profit over public health, ensuring that cheap processed food remains readily available and heavily subsidized. Meanwhile, fresh produce and healthy alternatives become increasingly expensive and inaccessible, particularly for low-income communities. This creates a system where the most vulnerable populations are disproportionately affected by diet-related diseases, further widening the health gap. We are essentially trapped in a system that prioritizes corporate profits over our well-being, a system that feeds us lies disguised as convenience and keeps us hooked on a cycle of dependence. But it's not just the food and pharmaceutical industries pulling the strings. Behind the scenes, there are countless other players influencing what we eat and how we think about food. From lobbyists pushing for favorable regulations to marketing teams crafting irresistible advertisements, the web of influence is vast and complex. We're also drowning in a sea of misinformation, bombarded with conflicting dietary advice from so-called experts, each claiming to have the ultimate solution to our health woes. One day, carbs are the enemy. The next, they're a necessary part of a balanced diet. It's a never-ending cycle of confusion. Fad diets come and go like fashion trends, each promising miraculous results, but often leaving us worse off than before. Celebrity endorsements add another layer of complexity, as we're led to believe that what works for them will work for us, despite our vastly different lifestyles and needs. It's enough to make your head spin faster than a salad spinner on high. The constant barrage of headlines, each more sensational than the last, makes it nearly impossible to discern fact from fiction. Fast food advertisements tempt us with convenience and taste, overshadowing the long-term health consequences. This constant barrage of confusing and often contradictory information makes it incredibly difficult to navigate the treacherous waters of healthy living. Families find themselves lost in supermarket aisles, unsure of what to buy. Health magazines offer conflicting advice, leaving readers more perplexed than informed. It's like trying to assemble a 10,000-piece jigsaw puzzle while blindfolded and riding a unicycle. Difficult, frustrating, and ultimately, not much fun. The sheer volume of information can be paralyzing, making it hard to take any action at all. The truth is, the answers are often much simpler than they appear. Eating real food, moving our bodies, and listening to our own needs can lead to a healthier life. Cooking meals at home with fresh ingredients and engaging in regular physical activity are foundational practices that have stood the test of time. Prioritizing our mental health is equally important. Practices like meditation, yoga, and spending time in nature can significantly improve our well-being. These activities help us manage stress, which is a crucial component of overall health. But these simple truths are often obscured by the noise of marketing and misinformation. Advertisements for fast food and pharmaceuticals bombard us daily, making it challenging to focus on what truly matters. In this sea of misinformation, finding clarity and making informed choices becomes a daunting task.